Good. Well, I guess it's still morning for you, Dr. Nora, and afternoon for me. Welcome onto the podcast. I'm super excited to have you.
Thank you. I'm excited to be here.
Yay. I know we had a couple other collaboration things that we were working on, so I'm excited to get those out too. I'm excited to have you on here because I love talking to providers who obviously come at it from the provider standpoint, but also have that like personal story, personal journey along with it. So if you want to share, your journey into motherhood and how that really impacted your career and your, how you practice pediatric dentistry today.
Yeah, so my journey is quite interesting. I didn't know much about airway health when I went into my pediatric dentistry residency. And I was in a residency program that only had two specialties within it, pediatrics and orthodontics. So the pediatric dentist would do a lot that let's say an oral surgeon or endodontist would do, for example. So we were getting a lot of referrals from a lot of different places because we were the only residency program in the state for dentistry.
Wow.
Yeah, for pediatrics at that time. So then we were starting to get referrals from the orthodontics department to extract premolars. And I had a mentor and she's a professor and a mentor. And she would tell me, Dr. Nora, get your hands off those forceps. You have up till 5 years after the age of maturity for them to come back and sue you for consequences. And I'm like, wait, what do you mean by consequences? Like, this is not something I learned in dental school. What could happen if I were to remove these premolars? And these were referrals that we were getting very frequently, if not daily. And I just felt stuck because I had, other program directors and so on, guidance providers saying like, this is what the orthodontic department needs of us. It's our duty. And I had one person telling me, go and learn more. And I did. So I started to learn more about if we were not to do those extractions, what could we do to further help the child? And what I learned is that sometimes we don't need to remove teeth to make the face fit the teeth. We can also have the face fit the teeth by creating space. And that's when I started to, and I had because of her, we talked to our program director and we asked an orthodontist in the area to come and teach us his techniques because this was something he was doing. So he came in, he taught us, and then I was starting to learn early interceptive orthodontics, early interventions to help kids. And what I noticed is that a lot of these orthodontic problems were just symptoms of sleep and breathing and airway issues that I had never learned about. And then I learned about myofunctional therapy thereafter. And since then, my world has never changed. I started doing tongue tie releases because I know, and we could talk about this more in my residency, because I learned that this can also help for speech, for breathing, and for sleep, and for so many different things. And I kept having kids come back and saying, and parents come back and saying, Dr. Nora, you won't believe it. My kid was never able to say the B sound or the T sound or the K sound. And just this week, I heard him saying all these words like, wow. And I would get chills up and down my body. Like there's something to this. Right. And then and then I started seeing very, very little ones, right? Babies. And I remember we were having call schedule. We were on call for like a week every month or so. And I was on call, and then I got a call from like the NICU, and they were like, hey, Dr. Nora, this patient can't feed. You're the on-call doctor. Come and help us. Looks like a tongue tie. I'm like, an infant? What do you mean? I'm like, oh my gosh, what do I do? So I luckily had like a provider that was a professor overseeing our care, and I learned. And since then, I saw feeding change, and that just blew my mind because I hadn't made that connection yet. And since then, life changed. I met my husband, and I got more and more into this. We met because of our mutual interests and other things, and we could talk about that later. But I got more and more into the field, and I had my own child, shortly thereafter. And of course, lo and behold, I put him on he came out, they're like, first thing you do skin to skin. So I put him on and they're like, why don't you try to breastfeed? So I put him on my breast and then I'm like, ow, this really hurts.
Mhm.
And they're like, it's okay, doctor. It's okay, Nora.
Mhm.
Your breasts will toughen up. It hurts a little bit when you first start. And I'm like, And I looked at my
Not right here.
husband. I looked at my husband. He looked at me and we were both thinking the same thing. I put my fingers under the tongue, lifted it up. And of course, it was only fitting for us to have a baby that was tongue-tied. I waited for the epidural to wear off and then straight to the office we went. And we had a body worker previous to release, and then the release treated. And then we also were working with the LC at the same time. And then we had Bodywork thereafter. And it was crazy to feel it. It was just wild. You've seen other parents go through this and tell you things are better. But then when you go through it yourself, it gives you a whole different meaning.
Oh my gosh, absolutely.
Understanding. So yeah, that's pretty much my journey. And since then, I've been lucky and grateful enough to help babies, kids with airway and functional health and support and tongue ties. And it's just been a really, really beautiful marriage of all the different things I've been able to
I love that.
expand my education on. Yeah.
Now, is Bodywork something that you recommend for all your patients that are going through tethered oral tissue release?
Yes, absolutely. I do educate all my patients on Bodywork because I think it's really important. The tongue in itself is the start of our fascia system. So the base of the tongue has our frenulum, and then for the frenulum, it started the fascia system. It goes down and lines our organs, goes deep down all the way to our toes. So we do see a lot of issues, a lot of, you would say, tension in the body with little ones that have tongue ties. We see sometimes torticollis and some relationships with torticollis. We also see some kids with digestive issues that could also be related. So Bodywork is really, really helpful to help these little ones at sometimes. And I think just educating new moms, because this is not something a new mom would know, that there are osteopaths and craniosacral therapists and chiropractors and body workers that can help infants, specifically infants. And many moms just don't know that.
So, this was, it was during COVID. So 2 years ago. And so many of my friends or friends of friends were having babies, and, you see them all on Instagram and it's like, oh, they're so cute, but our eyes are trained like, oh my God, that baby's tongue tied. And, that's not some of these people that I was seeing pictures of. They weren't close enough to me where I could just text them and be like, hey, how's breastfeeding going? Or the lack of breastfeeding, So what I did, I actually at that time on my podcast was having Michelle Emanuel on.
Yeah.
I reached out to these 3 specific new mamas and I was like, hey guys, I just started this podcast. I'm having this pediatric occupational therapist, IBCLC, she's an IBCLC, right? Yes. On the podcast, and I really want to ask her questions of like new moms. So like, I would love to hear like how your feeding journey is going, if you guys have any questions and so forth. All of them, bleeding nipples, blisters, using nipple guards, not knowing that they should reach out for help, not knowing that this shouldn't be a painful thing. Anyways, at the end of it, we had the podcast. I sent them, all of Michelle's answers and stuff. I ended up getting them hooked up with local providers in the area, and all 3 of them had tethered oral tissues released, and it was like a game changer for them. One of them actually just announced she was pregnant again, and she messaged me on Instagram, and she's like, literally the first place that we're going after we have this child is for Bodywork and to be assessed by an IBCLC. And I'm like, yeah.
And that's exactly the way it should be. And then those are the people that should like IBCLC should be doing these. I mean, our goal is for them to have done these functional evaluations, functional assessments before we treat, so that we can better help assist and diagnose.
Right.
So,
and it's
absolutely.
so frustrating here. I know obviously in different countries like Brazil and stuff, every baby before they leave the hospital have this tethered oral tissue evaluation. But my sister-in-law is a nurse, and she had taken a myofunctional therapy class because she came very interested in it. She wanted to know more. And she's in labor and delivery now. Cool. And she sees all these new mamas and all these new babies with tongue ties. And like, she has to like on the DL have these conversations with the moms, because it's not something that they want her talking about. And there's been a few times where like her superior, supervisor, whatever you want to call them, have come over and been like, that's not really something that we do. And it's like, what? I even had one of my best friends had a baby last April, and she was breastfeeding, but she didn't have a good latch. And the IBCLC came in, gave her a QR code and was like, scan this, watch the video, and let me know if you have any questions. So first time being a mom, my friend had, okay, well, I mean, she's feeding, so I guess this is fine. She was about to get discharged, and the discharge nurse said to her, oh, honey, no, something's going on here. Like that latch is not good. And if it wasn't for that discharge nurse giving her other techniques, she probably would have went home. The baby probably would have started to lose weight. She already wasn't gaining as much weight as she should have in the hospital. And it's like so infuriating. Like this is literally part of your job criteria. How are we not taking this a little bit more serious?
Absolutely. Yes. And it's just so beautiful to see people starting to come around and
Yes.
and putting things together for new moms so that they don't have to struggle and think this is all normal. Because I see so many toddlers, 3-year-olds, and they're like, their speech is not performing well and they're confused as to why. And I just saw one yesterday, a little 3-year-old tongue tied like to the tongue tip and but lip tied like to like with bone notching all the way to the palate and thick frenulums. And she's like, I had so many people, IBCLCs, this and that, and nobody told me anything. How come nobody said anything? And it's just, I think every healthcare provider is doing the best they can to help our patients. We wouldn't go into health if we weren't of the mindset to help our families and our patients. Meanwhile, there's some education barriers. There's not enough education. Definitely, I didn't receive any education about this when I wasn't done normal undergraduate dental training. So you have to really have that extra interest to learn more or go out and seek that knowledge because it's just not readily available.
Yep, absolutely. Now, do you find, I mean, it's probably been for so long now that you've had these different kinds of questions on like medical histories and questionnaires that you give out to new patients. But like, I know, for me, like sometimes when people come in for a myofunctional evaluation, like they're coming because their doctor told them to, but they don't really understand why. And when I start asking questions about birth history, even though the child's 12, and did they like tummy time, did they crawl, all of this stuff, they're like, why is she asking me all these questions? Do you find with some obviously like newer patients that come in, are they confused as to why you might want to know things about that? Like, were they breastfed or bottle fed? Like how do you feel about that?
Yeah, there's definitely a wide range of patients that I see. Some patients are just extremely educated and they've done all of their research because they've gotten so many misdiagnoses for so many different things. And then they eventually found somebody that could help. And then I have some parents that come to me because I also do low toxic dentistry and I do things that are more functionally related in the dental health field. So when I ask these questions, they're like, how does it connect? And it blows their mind to see the connections and understand. But I do explain a little bit as to why, because I want them to learn. So that if they have family, friends, or more kids, they can also help people in their community.
Now, how do you, when you talk with parents, whether they're infants or it's more just education based, let's talk about a little bit about the connection between tummy time, well, the importance of tummy time and why like an infant that has a tetheroid tissue may not particularly love tummy time.
Yeah, so it's really important, I think, to have a good amount of tummy time, really just starting from like a few days, right around birth, because we want to help develop core strength. And kids with tummy time, sometimes they have digestive issues, reflux, some of those things. Tummy time might not be the most comfortable. Sitting up, mostly up and holding mom might be more comfortable than being laid down on the floor. So it's really helpful to work with an OT that has knowledge and training in infants and with tummy time, because my own son also had so many issues. I ended up working with an OT and she was amazing. And we worked on doing tummy time on a ball or on my body versus directly on the
Awesome.
floor. So
Yep.
even though he had his release, he still had residual consequences of that effect because the tongue tie is developing in utero. So
Right.
even if you release really early on, there'll still be challenges along the way.
Absolutely. Now, what about the whole nutrition aspect? Is that something that you guys focus on a lot in your practice, like talking about the importance of eating, of chewing, eating wholesome foods?
Yeah, I do. And I find that many parents are so excited and fascinated about
Mhm.
about the relationship between the type of foods that we offer, within the first, let's say sometimes 6 to 9 months of
Yep.
infancy and how their jaws develop. And it's important to tell parents like to try to offer different types of food if it's possible, if they feel ready, if a feeding therapist also agrees that the child is ready to start offering foods that are more whole versus more just puree led foods. And
Mhm.
once the child does exhibit the signs of readiness, that helps develop the jaws and expand the jaws, which will eventually help influence the airway
Mhm.
and help influence the airway health. And we do see a relationship between kids that are mostly fed like, by 2, 3 with
Mhm.
pouches or with more soft foods and have more difficulty eating those hard foods, and their jaw size and the relationship to the jaw size to the tethered oral tissues. So um, just educating on the types of food that are important for their whole health, like D3 rich foods, K2 rich foods, talking about prebiotics, probiotic rich foods for their gut health, which also helps the oral microbiome. And
Mhm.
this is all going to help have with brain development, jaw development, sleep health, having low sugar foods, for example, high magnesium rich foods at night.
Mhm.
These are all things that we can easily talk about. And I give, so after every appointment, first comprehensive appointment with a patient, I give like a take home guide with
Okay.
specific notes for that family. And I give them a list of foods that, for example, that are relative to their diet, their home diet. So if, like, for example, a family has, religious reasons that they can't eat certain foods, or just their lifestyle, they can't have certain foods. So we break it down so that it's feasible. So it
Yeah,
doesn't seem unreachable to parents.
absolutely. And I think, to your point, like it's just the barrier to education on all of this. And I always say, I wish there was like this mandatory class that like new moms, or not even new moms, like all moms before birth, even if it's your third child, should have to take, just to be able to, again, receive all of this education and to really, understand the importance. I mean, of course, certain things are more convenient than others, but I feel like if moms were really geared with all of this knowledge, like they would make better choices of what to, because somebody doesn't give their child a yogurt pouch thinking it's bad. They're giving their child a yogurt pouch thinking they're getting their serving of fruits and veggies, but not
Mm.
understanding the component that they're now missing just because they're not aware. And I just wish that it was just something that all moms could have access to this information. And I know obviously with everything that's evolving, with this field and all the work that you guys are doing at the Breathe Institute, there's just so much more access to this stuff, which is great. And all the books that are coming out. But man, what a world would it be if literally every mom knew this stuff?
Totally, it would. And yes, but the information is getting out there slowly and surely. And of course, we can't do, as moms, I'm a mom too, we can't do it all. It's not going to
Right.
be 100% all the time. But
Yep.
what we could do is just try to give it 80/20 or do what we
Yeah.
can. And that's all
Yeah.
that matters. As long as we know what we can do to make things to get to the place that we need them to get. Yeah.
Absolutely. Now let's talk a little bit about pacifiers. I mean, I know obviously as a dentist, you don't particularly recommend pacifiers. If a child is going to be using a pacifier, up until say 6 months, is there a particular pacifier that you would recommend?
Yeah, I think pacifiers sometimes are a necessary tool for many families, and using the appropriate pacifier is also more beneficial. I like pacifiers such as Avent that have a rounded tip. or passive. I like particularly the Ninny because it is shaped like a breast and feels like a breast. So it does help with patients that are breastfeeding without giving them too much nipple confusion. So those are
Yeah.
the two pacifiers I recommend. I don't advocate for orthodontic pacifiers. And the reason I put that in quotes is because I see from clinical practice, the most open bites and the most cross bites, or for those of you that are not in dentistry, malocclusions, meaning that bites that affect the way that the palate is shaped, the way that the teeth come together, and a lot of times the ability for the tongue to remain on the roof of the mouth. And the reason is that it forces the tongue to remain down. We want at least the lateral borders of the tongue to stay up, which occurs more so with the Ninny and the Avent rather than an orthodontic pacifier that truly pushes the whole tongue down. So I try to explain this to parents. You know, I love when I get little. My favorite kids are the babies because there's so much I can do. And most important thing, and something that I'm advocating for, is to continue care, having a continued care model. Tongue-tie providers where you snip and you say, hey, here's one follow-up, two follow-ups, see you later. This doesn't provide quality continued care. We have to see our patients. If we saw them around, at around the time of birth, we should be seeing them 1 or 2 follow-ups, and then seeing them at 6 months, and then seeing them at a year, and then seeing them at 18 months, and then maybe even seeing them more frequently if need be, because we're going to help guide them. And most of the, it's interesting because in the first couple of years of life, so much of their experiences come from the mouth. Right? The speech and feeding and transitioning from a passy and breastfeeding. Like the mouth is so important, like it is for a lot of life, but more, I would say, so much that a pediatric dentist can do, or a dentist that treats kids, or myofunctional therapist, IBCLC feeding therapist, body worker that's trained in these things, that can help these kids stay healthy over time.
Absolutely. And what about sippy cups? Is there a particular sippy cup that you would recommend?
I don't recommend sippy cups just because they don't optimize the proper tongue posture that helps advocate for the appropriate mature swallowing pattern. So I like to provide options for parents like thermos fontainer or things with a bent straw. If they're just learning how to use a straw cup, there's something called Ola Baby that's made with silicone. Or I recommend the Honey Bear Straw Cup through Arc Therapeutics. Those are good ways to start to learn how to use a straw until they can graduate into a bent straw that's that helps us kind of keep our lips onto the straw tip and help advocate for that mature swallowing pattern. So, and then of course an open cup is really optimal too when possible, but a lot of moms are on the go. So just try to be realistic with what options could be most helpful.
And that's, I was having this conversation when we were talking about something earlier about a particular post that I had made. And that's the thing, we have to meet families where they are, right? There is always a super ideal perfection, but all right, let's be real. Who really can do that? You can't, you have to meet parents where you are. So like you said, it has to be an 80-20 thing, and not, you also don't want to go putting all this pressure on moms that they have to do all these million trillion things, and if they don't, their kid's not going to thrive ever. That's very stressful, I'm sure, as a parent to hear. So if there's little things that we can do to just keep going in the positive right direction and continue giving, to your point, continued care, so that they're still getting that knowledge and that education from their providers to be able to help their children. But that's one of the biggest things is you have to meet families where they're at. And I find that a lot with myofunctional therapy. When you first become a myofunctional therapist, you have all this knowledge and you just want to throw it all at the patient all at once. And then the family's whoa, that was a lot of information. I wasn't ready for that. And we had a couple families who, one of the moms literally said to me, she's like, I turned my listening ears off. She's like, I respect you as a healthcare provider, and I know I need to hear all this information, but I wasn't expecting it. So, sometimes for particular families, you kind of have to just hold their hand and walk them through it a little bit differently. And there's nothing wrong with that, but just being able to know how to deal with, different scenarios, I think is really important, because at the end of the day, we're all just trying to make a difference in our families' lives.
Totally. Absolutely. That's so true.
Now you talked about the Ninny pacifier having more of like a nipple shape to it, so it would mimic more like breastfeeding type. Is there a certain bottle that you would recommend that kind of has the same impact?
Yeah, absolutely. I think it's really important if there's issues with bottle feeding to get a functional assessment from a feeding therapist and working with a feeding therapist. But just generally, if you're a new mom, just trying to have some bottles available in case, breastfeeding, in case you have to go to work pretty soon and you're not sure how breastfeeding will work for your schedule. So having bottles such as the Dr. Brown's narrow bottle, I like to have bottles that are glass if possible, just to be conscious of BPA and BPA derivatives. And then there's also the Avent, and I like the Guli Cola, Gulicola. I hope
I like that name.
Right. Saying right. But those are 3 different bottles that I've seen help with have a graded tip, and I've seen help to also optimize, breastfeeding if needed, if that's on the journey for the parent.
Yeah, these are all great tips, because I know, I get a lot of Instagram messages. I know we all do that are in this field, and this obviously isn't my area of expertise. I always am sending like feeding therapist websites and things like that. So I think, the listeners listening will appreciate those suggestions. Now, I always like to talk about clenching grinding, because I feel like we all kind of learn the same thing in our undergraduate programs. So where did that connection come for you, that clenching and grinding is more an airway symptom than saying like kids grind their teeth, they'll grow out of it type of thing?
Yeah, so it's fascinating. When kids are very, very young, like I would say between 0 to 1.5 or 2, we sometimes see grinding or moving the teeth together at night due to transitional dentition, teeth coming in and then the child trying to find the place as to where the teeth come in. Meanwhile, I think it's really important to get looked at by an airway focused dental health provider if we're noticing this, just to get all our bases covered. Okay. When we get a little bit older than that and we're still noticing these issues specifically, and we see, potential mouth breathing even related as well, it could also be a sign of a few different things. One could be an airway related issue like enlarged tonsils. Another could be nasal blockage. Another can be a tongue tie. And there was a study that we did, myself, Dr. Ghodousi-Zaghi, Dr. James O, and Dr. Audrey Yoon, and a few others with UCLA, a group of baby children at UCLA. And we wanted to look at specific factors that might be related to sleep bruxism. And what we found, and I always hypothesized, which was like, I'm like, listen, I've seen this in my patients. The ones that are grinding, a lot of them have tongue ties. So I just put that out there, and we went on the research, and we did find that there was a statistically significant association with children with tongue ties and those that had bruxism. And what we hypothesize is that the low tongue posture causes the tongue. So when we sleep, all the muscles in our body relax, right? Including the 16 muscles of our tongue. So if our tongue is low, whether due to a tongue tie or due to low tongue tone, what we find is when we sleep and all the muscles in our body relax, the tongue can fall back and obstruct the airway, making it difficult for a person to breathe. And what the airway is comprised of is the back of the tongue, the pharyngeal space, the tonsils, and there's also the adenoids behind the nose that we can't see, right? So if there's any inflammation in that area in the tongue, or if the tongue is falling back, it would be natural for a person to move that jaw forward to help them breathe better. So what we see, it's a hypothesis, sometimes stress is related, so on and so forth. There's been some research and hypotheses showing that parasites could be related to bruxism too. So of course it's multifactorial, but it's important to get an airway assessment as well to help rule out, especially by a functional dentist, to rule out and determine what it exactly is, rather than just saying we'll grow out of it.
Right. Absolutely.
Yeah.
Absolutely. It's fascinating, and the continued research that I'm sure you guys, will do and what will come out, it just helps to support everything, because I don't know how, it is in your area, but a lot of times in our area, you know, we find one thing, maybe even the pediatric dentist finds something, and then they go to their pediatrician, and the pediatrician's like, this is fine, this is normal. And it's frustrating, but to be able to send them, you know, the study like you just talked about, is it arms us, it gives us something to be able to like, look, like we're not making this up.
Yeah, it's evidence-based. We do
Yep.
evidence-based diagnoses. And also it's important to note, as a dentist that's more airway focused, that's done the education and training, and as a dentist that's more functionally trained as well, we have to recognize that we are the oral physicians. We are oral physicians of the mouth. Just so a pediatrician is doing their job to make sure that your child is thriving and they don't have any serious ailments, and my pediatrician specifically makes sure that our nutrition is okay, and you know, we're making our milestone, we're making the milestones, we're hitting where we're supposed to be at. But this is where we really where we really shine. What we do, we treat the oral cavity, the head and the neck, and the sleep and the breathing for many of us too.
Now, what would you say to a mama that reaches out to you, say on Instagram, and says, you know, my baby is 4 months old and they're sleeping with their mouth open? What should I do?
That's a really good question. So if I try to go through a few different, I mean, Instagram is tough because it's virtual and I can't see your child and I don't really know why. So this is something I would do. One is I would recommend that, one, they start doing tummy time. Two, that they start doing something called the sleeping tongue posture hold, holding the tongue right at the soft part of the chin up so the tongue can press up on the roof of the mouth to help seal the lips together and optimize nasal breathing. And then what I would do is I would try to clear the nasal passages, and you can use regular saline drops to help clear the nose. And then at the age of 4 months and up, it's safe to start using something like X-layer drops. And those are like little drops that you can put in the nose, and you can use something like a feed a baby or a nasal aspirator to clean the nose thereafter. And this just helps clear the nose, right? This makes sure that we have a padded airway so the child can breathe better. And then if we're still noticing persistent issues, regardless if we are noticing persistent issues or not, I would have them potentially see if they're breastfeeding, for example, on IBCLC to do a functional assessment, to just, if they have training in tethered oral tissues or they have some extra knowledge, just to kind of take a look and see if there's any relationship between what they're seeing and potential tethered oral tissues. And then or seeing a provider in the area that would be able to help further treat their child.
Now I know you're doing palatal expansion. What is like around the youngest age you would do palatal expansion on?
Yeah, that's a good question. So there's palatal expansion that could be done like with, for example, getting the tongue, like you can, by getting the tongue up, that's the child's most beautiful type of natural palatal expander. The tongue provides up to 700 grams of force, and it only takes 1.5 grams of force to move a tooth, right? So when we have a child working with maybe, for example, palatal massage techniques, something you could potentially work on with a feeding therapist or a motor therapist, or and getting that tongue up with sleeping tongue posture hold or potentially guppy pose, things of that nature that a therapist would probably work on with your child. And then closer to 6 months old, we can start using tools like a baby munchie, and that does also help the tongue get up to the roof of the mouth, strengthen the muscles of the jaws, cheeks, and lips, and help with lip closure, and it helps with lip closure, and it helps get the tongue up to help expand the upper jaw. When kids get a little bit older, you could go, like, for example, 1.5 or 2. I like to use like infant trainers from MyoBrace, and a little bit old, well, with the techniques with my oral motor therapist. I try to do as much. Well, I always work with a therapist with my patients. And then thereafter, you know, we can use traditional expansion techniques. Like, let's say when the second baby molars come in, sometimes we can work with an ALF, for example, to help expand the upper jaw if it's needed and the child is cooperative and the parent and the child are willing.
Mhm.
And that's what the next step is needed for that child for whatever reason. And there are other traditional expanders and removable and fixed expanders that you can do as time goes on.
Absolutely. Thank you, Dr. Nora, so much for all this information. It was very insightful. Is there anything that you want to leave the listeners with before we wrap things up?
Sure. I want to leave the listeners with a bit of advice. One is trust your intuition and your gut, because if you're feeling something and something's not right, just do a little bit of extra research to make sure, and find the person that maybe can help, because very rarely does one doctor know everything. And it's important to work with a doctor that has an understanding of collaborative care and what that means, because I work so frequently with many, many, many providers that help my patients, and it's a journey, and that's okay.
Absolutely. Thank you so much for that, Dr. Nora. Thank you for taking the time to chat with me today. I really appreciate it. And we hope that you have a wonderful rest of your day.
Yay, and thank you for having me.